Okay, I think we'll make a start. I can see there's still some people coming in, but the numbers sort of slowing down a bit. So I think that means most people are here. Welcome to the first sunny evening of a work day for a little while. Really nice to have you all with us today. Our So What seminar this evening is entitled, So What Does It Take to Effectively Support Children and Young People's Mental Health and Wellbeing in Schools? We've got a great packed agenda, which I'll talk about a bit in a minute, but just a bit of housekeeping before we start. So just to let you know, this session is being recorded, and we will be making the video available via the AFC YouTube channel. So just be aware of that. There are closed captions if you want to read what people are saying as well as listen. The chat is disabled, but if you do have any questions, please do put them in the Q&A. Likewise, if you've got any technical issues, please pop those in the Q&A as well. We'll also be circulating the slides by email using the contact details you signed up with, so they'll be coming around after the session. I think I have covered everything there, but Martha, have I missed anything?
No, you've covered everything.
Thank you. Great. If we move on to the next page, then that should have our agenda. So yeah, we're on the introduction at the moment, and as you can see, we've got 4 presentations for you, all sort of giving a different glimpse into work in schools and possibly colleges as well. And then we'll try and keep to this. If everyone manages to stick to time, we'll try and get in just a quick break so people can just shake their legs a bit. And then we're going to have a Q&A panel discussion with the speakers joining, as well as champions from the centre, parent and carer champions and young people champions. So we're really looking forward to that discussion. So please be thinking as you go along of what questions you might want to ask, and feel free to sort of log them in the Q&A and we can come back to them afterwards. And then we'll just have a bit of wrap up and reflection by 7 o'clock. Great, thank you. Next slide. So just a bit of a introduction to who's with us today. I wonder if I can just actually maybe we'll put faces on in a minute, but perhaps those who are listed might just pop their cameras on for a minute so you can wave. So I'm Jess Dayton, I'm Director of Applied Research and Evaluation at the Anna Freud Centre. I'm also Professor of Child Mental Health and Wellbeing at UCL and Director of the Evidence-Based Practice Unit, too many titles, but really nice to be with you today. We've also got Hannah Woods with us today, Head of Service for the Schools and Colleges Early Support Service. Hannah, do you want to just say hi?
Hi there, everybody.
More from you very soon, I think. And we have Roisin McAvoy, Head of Schools Training and National Programmes. She's waving. Lee Atkins from our Child Outcomes Research Consortium.
Hello, everybody. Good to see you all. I'll speak to you soon. Thank you, Jess.
Thanks, Lee. And Anna March, who is still a PhD student, but also a postdoc at Exeter. If it's possible to be the two at once, I think it is. Great, thanks, Anna. And if our champions are Ash, Dina, and Nicola, do you want to also just say hello?
Hi, everyone. Lovely to be here today, and we're really looking forward to your questions later on.
Thanks, Nicola. You can see Ash nodding. And there's Dina. Great.
Hello, everyone.
Brilliant. And Martha, do you want to just hop on and say hello? You'll be chairing our panel session a bit later, won't you?
Yes, I'll be putting all your fantastic questions to this wonderful panel later on. So I look forward to that.
Lovely. Thanks so much. Okay, let's skip on. So just a little bit of background. So these So What seminars are hosted by the Evidence-Based Practice Unit, which I mentioned I'm co-director of, actually, with my colleague Julian Edbrook-Childs. The Evidence-Based Practice Unit has been around for quite a while now. It's a collaboration between the Anna Freud Centre and the Faculty of Brain Sciences at UCL. And the idea is that it's a way of sort of carrying out quite applied research, so bridging the sort of more traditional worlds of research and more sort of innovative practice in children's mental health. So making sure that everything we do kind of follows this so what principle, if you like, that there's something kind of practical that we can say about what the research means for how those working alongside young people might support them better. Within the Anna Freud Centre, we work very closely, actually, with all the people who've been named here, particularly the Child Outcomes Research Consortium, because they do a lot of research alongside us, and Cork has a sort of membership kind of model, and again, it's been sort of working alongside EBPU for well over 10 years, well over 12 years now, in fact, and the emphasis for Cork is much more on sort of using evidence to improve practice, so very much a sort of pragmatic pipeline of evidence to improve practice, essentially. But of course, we work very closely with the schools division, who are well represented here today. Next slide. So these So What seminars are essentially embedded in that kind of ethos of applied research. We're based in the Applied Research and Evaluation Division at the Anna Freud Centre. And the idea is very much like the ethos of the EBPU. It's to sort of think about, how do we draw out what research means in the real world? And can we get some of those who work in different settings or have sort of lived experience to help us think about how we can tease out as much sort of meaning as possible from the research that we're learning about. Great. Okay, next slide. This is just a reminder to follow us on Twitter. So any of these future So What seminars, but also any research findings, this is where we sort of disseminate all our learning. So yeah, please do follow us. Yeah, and that's all from me. So I'd like to, without further ado, hand over to Hannah Woods to talk about whole school approach. Hannah, thanks so much.
Hi there, so I'm the head of service for the Schools and Colleges Early Support Service. So we work into 200 schools across England and now in Wales as well. So we offer evidence-based intervention for mild to moderate mental health difficulties, and we also work to mobilise the systems around the young people. So we support staff in schools, and we offer training as well as part of that approach for peer support initiatives in schools, and we advocate for a whole school approach to mental health in wellbeing. We do that across the centre as well, not just in the service that I work within. Next slide, please. So what's the current educational context regarding mental health then? Well, the government's pledged funding to implement mental health support teams in the 2017 Green Paper. And these are well underway, but they will only reach a target of 35% of schools by March 2024. So we recognise that there is a gap there in provision, and my service moves some way towards closing that gap by offering similar interventions for mild to moderate mental health difficulties. That funding from the government also pledged funding for training for a senior mental health lead in each school and college as well. So that training is now being rolled out, and it is offered by the centre as well. But predominantly the paper positions schools within this progressive universal approach, putting mental health promotion and early intervention at the heart of what schools and colleges do. So that's the current educational context around mental health in schools. Next slide, please. So it is widely recognised that schools have a role to play in facilitating pupil success by supporting them to be resilient and mentally healthy. Ofsted recognised that within their 2020 framework as well. And Aston sees this through a lens of an ecological framework operating at macro, meso and micro system levels. So macro is the wider societal influences on mental health and wellbeing for our children and young people. So the impact of policy, political and curriculum ideology, cultural influences and societal attitudes to mental health and wellbeing. So at the meso system level, this is where the whole school approach would sit. And this is a coordination of provision. It connects the internal practices with external agencies and systems of support. And then there's a micro system as well. So this is the positive individual developments of the child or young person, their interactions with peers, so school and their parents as well. Next slide, please. So how best to promote wellbeing in a school context? Well, Banerjee et al. Described an interaction of mental health, psychological, pedagogical and systems perspectives as to how best to promote wellbeing in a school context. And the mental health emphasis might include approaches that are meant to reduce the prevalence of existing and measurable mental health problems. The psychological perspective focuses on the use of evidence-based programs to promote and improve emotional wellbeing and mental health. And the educational perspective tends to focus on the dynamics of different teaching and learning approaches, such as group work and collaboration. With the systems perspective, having a focus on school leadership and management, pupil participation, links to wider community and organisations such as the NHS, third sector and local authority. So might a whole setting approach which encompasses all of these elements be best practice then? Next slide, please. So what is a whole school approach to mental health and wellbeing? Next slide, please. So there's been lots of frameworks developed to support whole school approaches to mental health and wellbeing, and the most commonly known and utilised is the Public Health England model, which I'm showing here. There are commonalities in all the frameworks of whole school approaches, and they include an underlying commitment from leadership and management to improve children and young people's mental health and wellbeing through a kind of whole setting multi-component approach. But essentially, it is a coordinated approach across an educational setting to promote positive mental health and wellbeing, promote early identification of mental health and wellbeing difficulties, and it provides support to those in need, either internally or externally through signposting. Implementing a whole school approach should really be seen as an incremental change management process, which encompasses all areas of the school and community. So I'm going to just take you through each of the segments of the whole school approach wheel now, if you like, and just outline what some of the literature says about the best practice in these areas. Next slide, please. So how is a whole school approach implemented? So there needs to be a real focus on the leadership and management. So I've touched on this already, but there must be a total commitment from the senior leadership team. It's really essential. They need to commit to promoting both staff and student wellbeing, and there needs to be a commitment to professional development and new ways of working within the setting. It's also important to recognise the alignment of schools' policies and practice around behaviour, diversity, the challenge of prejudice around ability, disability, gender, race, and perceived social status as well, but that'll be particularly significant for school wellbeing. And lots of self-assessment and improvement tools have been developed to support a whole school approach, and they all recognise the critical function of commitment and leadership of this work from the senior management team. So it really does start at the top, any whole school approach. Next slide, please. So ethos and environment. So what do I mean by that? Well, a school's ethos and environment serves as a key determinant of the wellbeing and mental health within that school. It connects many of the other areas of a whole school approach. The literature suggests that there's several core components to building a strong ethos and environment. So we've got this idea of policy alignment again, and promoting an ethos and environment where pupils feel heard. This promotes a sense of belonging and connectedness at school. And again, we've got the staff wellbeing being really key to this. When young people feel listened to and their opinions are valued, it enhances a feeling of belonging and connectedness. Promoting and supporting staff wellbeing is a really explicit way of making a commitment to wellbeing through ethos and environment, and stress levels of the staff really need to be key to any approach. Next slide, please. So in terms of the curriculum, teaching and learning, approaches to improving mental health and wellbeing can be done as part of a multi-component or a single initiative. And the literature suggests that these both work well when integrated within the whole school approach that promotes this sense of connectedness. And the quality of the programmes and the consistency with which these are implemented does have an impact on results. So we need to bear that in mind and show fidelity to any models that we are implemented on a whole school one-to-one or class level. Universal social and emotional learning interventions not only enhance young people's social and emotional skills, but these have also been shown to reduce symptoms of depression and anxiety. So it is really worth investing in social and emotional learning initiatives as well. Next slide, please. So staff development and support for staff wellbeing. So I have touched on staff wellbeing already. But school staff also need to be trained in key areas such as child development, so the ages and stages. So an example of that would be the teenage brain and how that impacts upon how young people present and relate to others, including staff and peers. They need to be trained around early identification and prevention of mental health problems and promotion as well. Again, staff wellbeing is key. The Mentally Healthy Schools framework, which I'll be sharing within the chat later, has been shown to improve mental health literacy among staff and led to action in improving their own mental health as well. So we have got some resources that we can share with you around staff development and staff wellbeing. Next slide, please. Enabling student voice is really key. It's important to say as well that schools should harness the voice of all their pupils. This can be done through student councils and panels, surveys, suggestion boxes, or in a more structured way, such as focus groups or in PHSE workshops and lessons. Consulting pupils on policy development and enactment is really key. It improves a sense of control and fosters a belief that individual opinions really do matter within the school. And again, encouraging schools to be inclusive and creative in their pupil voice work and harnessing the voice of all students is important, not just the pupils who tend to be more articulate. We want to include the whole school community when we harness our student voice. Next slide, please. So Blanc et al. Identified strong evidence to support parent training and education in the implementation of interventions to promote pro-social behaviours. It's really key that we work with parents and carers to support not only their wellbeing, but the wellbeing of the children and young people within any setting. We're 2015 described working with parents and carers, described that work that schools do as working in a partnership, and described that parent care involvement is whereby family life can kind of be used to reinforce messages from school, to support parents and carers to develop their own skills and attitudes as well. Involving parents and carers in policy development as well is really key to the whole school approach and showing that we're involving the whole school community. Next slide, please. So part of a whole school approach is to provide targeted support and appropriate referral. So schools should really be aware of at-risk or vulnerable groups of children and young people, and they should identify early those who may be at risk, and not just those young people already experiencing difficulties. Schools should be able to deliver evidence-based interventions to these young people or be able to refer on for that. There should be curriculum-based and one-to-one smaller group work initiatives, and targeted evidence-based interventions also need to be evaluated robustly, whether they are carried out within school or by an external provider. So that is really important as well. Next slide, please. Oh, just it's important to say as well, sorry, can we just go back to that slide? So the Early Intervention Guidebook summarises and rates lots of programmes and interventions for effectiveness, and I'm going to provide a link for that as well, so that schools and colleges can review interventions available. Next slide, please. So in terms of identifying need and monitoring impact, we need to ensure that we are harnessing pupil voice work around any initiatives that we are embedding, so focus groups, worry boxes. Audits and questionnaires can be carried out on a whole school level or with a specific cohort, and you might want to do staff wellbeing questionnaires or use evidence-based wellbeing measures for the whole school community and the pupils. So use of validated screening and assessment tools are really recommended. It's important to share information between agencies that might be working with an individual within your setting, and pastoral staff should really have that key knowledge of children and young people and use screening and assessment tools to inform their work with children and young people. Next slide, please. So what is the evidence for effectiveness of a whole school approach, and how is that impact measured? Next slide, please. So in a best practice review of whole school approaches, which were implemented as part of the mental health support teams across the South East and the East of England, Proctor et al. Found the work on systematically monitoring and evaluating characteristics and needs relating to whole school approaches to not be as robust as they would have liked to have been. But they did find several examples of effective practice in routinely collecting and analysing that data. So this included aggregation of pre-existing data that schools already have to detect trends, whole school survey data on school climate, belonging and well-being, and audits on school characteristics and practices relating to emotional well-being and mental health as well. So it's important to harness data to measure the impact of any whole school approach work that you'd be doing within your setting. Next slide, please. And we do, as a centre, as Anna Freud Centre, offer a framework, which is an evidence-based tool, and it is based on the public health principles of whole school approach that I've just given examples from and talked you through. So if you do want to access that free framework to use within your setting, then the resources will be shared at the end of this. Thank you.
Brilliant. Thanks so much, Hannah. That was a really comprehensive whistle-stop tour, given your very short window within which to do it. Fantastic. So next, I'd like to introduce Lee, who perhaps is going to talk through, well, we didn't quite do a whole school approach, but some of those principles come through in this project, I think, don't they, Lee?
Absolutely. Yeah, thank you, Jess, and thank you, Hannah. Yes, I think there's huge overlaps with the content from Hannah's presentation there, and I'll refer to it in this presentation. So I'm Lee, as I mentioned before. I worked on a project we call the Mercer's Wellbeing Evaluation Programme. I want to spend just a very, very short time explaining about the project and what was involved, and concentrate the most of my time on so what is interesting, what can you learn from this, because that's really important. And one of the key aims of the project is we get the learning out there for other people to harness and to use to improve their kind of support for children and young people. Next slide, please. Okay, so very briefly, a background to the programme. It was funded by the Mercer's Company, which were originally a library company going back some time, and now a philanthropic organisation committed to supporting good services and helping children and young people, etc., etc. A part of which is they support a range of schools and colleges to provide better support for children and young people, educational support, wellbeing support, or the whole kind of gamut, if you like. So as such, they funded us to do this project for 3 years, and due to the success of it, they gave us another 3 years. So 6 years in total of the project here. And in this project, we engaged a range of schools and colleges, primary, secondary, all through colleges as well, in different types of activity, which I'll explain in the moment. In total, I think 16 to 20 schools and colleges were engaged, and membership obviously came and went, things like that. It varied for about 6 years, but I think on average we had about 13 at any one time point there. And suffice to say, and what's really interesting about this project is the diversity of these schools and colleges was really interesting. We had some kind of state-run schools who were dealing with very deprived cohorts of pupils, and we had privately run schools who were dealing with international students and aiming to achieve really kind of high-level results and get their students into the top universities in the world, if you like, and all things in between. So really fascinating. The initiative behind it, before I go back into that, the key initiative behind the project was that all the schools and colleges that Mercer spoke to said 6 years ago there was a rising need for mental health and wellbeing support for pupils in schools, and a rising recognition that schools could do more in this space. In particular, next slide, please. Yeah, in particular, how do schools identify which interventions to provide for pupils and staff? How do they know if their interventions are working, and all things associated with that? In kind of the key things behind this was there's a very limited evidence base for school-based mental health and wellbeing interventions. Where it does exist, often it's from overseas, and sometimes, and very often, it's kind of funded by kind of marketing budgets from big companies, things like that. So it's kind of very limited, and also quite inaccessible evidence base. So kind of academic papers, things like that, not really accessible for schools to kind of really digest and use evidence base. Often the evidence is inappropriate, so it's kind of data from some time ago in a different country. So we have reports from the 90s in America, etc., etc. And even now we know we have kind of pre-pandemic and post-pandemic situations. So a lot of the pre-pandemic studies may not be reliable to a post-pandemic world, if you like. So the appropriateness of the available evidence is also an issue. And lastly, in this area is we know, and we also confirm this for the project, that the context to each school is massively important. Every school is different. I mentioned the diversity of schools and colleges in this project in itself. You can imagine how different they are to each other, but also how different they might be to other schools in, overseas in America, Canada, or wherever it might be, Australia, etc., etc. So context is everything, as is implementation. The way an intervention is delivered in a school will differ hugely. We know and discovered. So things like mindfulness, peer mentoring, adult mentoring, school counselling, play therapy, these are kind of groups of interventions, and they often look very different in different schools, and that's a massive impact on their impact. There is no kind of one set idea of what school counselling or play therapy or those things are. So implementation and context are massively important. Next slide, please. So the main elements of the programme are a pupil wellbeing survey. So each of the schools involved were given the opportunity to each year to implement a wellbeing, mental health and wellbeing survey over the 6 years there. I won't go into detail about the survey, but there will be a link. I think at the bottom of my slide there, you'll see the link there. You can access all of those surveys. You can read all about them. Really great tools, using other projects as well. Yes, I'll talk a bit about them in a moment. Another important part of the project is providing opportunities for these schools and colleges to come together and share their experiences and share learning and discuss problems, things like that, and collaborate. And that came out of the feedback from the project as well, so I'll talk a little bit about it in a moment. And a key part of it is obviously supporting these schools and colleges to understand how to measure the impact of interventions, how to understand the impact of interventions, and what to do with that kind of information and data. Next slide, please. Okay, so in essence, there were 3 levels or tiers or elements of the project. So I've mentioned the bottom tier briefly in terms of the mental health and wellbeing pupil survey. So all schools were given a chance to do this survey. In 5 of the 6 years, the survey was administered, implemented in schools. You may remember there was a pandemic which kind of shut everything down for 1 year, so that weren't able to do it in that year or implement it in that year. And a smaller number of schools implemented the survey the following year. But actually, in 5 out of the 6 years, we saw schools and colleges implement the survey, which is fantastic. And we saw over 10,000 pupils complete surveys in those 5 years. So really lots of data, lots of information, really fantastic. And each of the schools on the back of their survey received a bespoke report with all their findings. And that started off as a PDF. And then by the end of the project, it was an online tool which you could kind of click on things and compare boys and girls and things like that. And really exciting kind of innovation throughout the 6 years. So you're really exciting. I suggest you do read about that if you're something you're interested in. In the green box here, a key tier of the project was supporting all of the schools and colleges to embed a method of evaluation to understand what impact their interventions or their provision is having on pupils. So each of the schools identified something they were either doing or wanted to do in their schools, or interventions they were thinking of, and we helped them evaluate that. And I'll talk about that in the next couple of slides. And at the top of the tier, we ourselves, the project team with EBPU and Anna Freud and Cork, were able to help schools design, and we delivered what we called in-depth evaluations. So that's us doing the evaluation work and providing a report back to the school. Very often, I think in most cases, that involved interviews with staff, interviews with pupils, post and pre and post interventions, using of measures, and we collected the data and then sort of analysed it and reported back to the school. So that was really exciting and kind of showed the schools the power of evaluation, if you like. Thank you. Next slide. Yeah, so lots of words on this slide, but it's actually a bit easier to digest than it looks. So this is the approach we took to supporting schools and colleges to evaluate the impact of their either their current interventions or their planned interventions, it might be. So the first step was supporting the schools to kind of put together an intervention description, often called a tidier in technical language, as you can see there, having a clear description of what the intervention is, what it's aiming to do, who's it for, how it's delivered, how many sessions, who delivers it, and any risks and things like that involved. So kind of comprehensive description of the intervention. Following that, we supported sites to complete a theory of change, and the model we used was a logic model, which the EBPU have kindly and nicely condensed in something which I think is really usable. I'm going to ask at this point, Rachel, if you can put the link into the chat for people. There you go, on the ball, fantastic. So you can see the link to what I'm talking about there. Very simple logic model, which allows the school sites, anybody really, to kind of be clear on who the target audience is, what intervention is, and what outcomes it will aim to achieve. So be very clear on what you're expecting to change as a result, or what the difference it will make, your intervention. And that gives a clear idea of kind of what then needs to be measured, or what data you need to collect, which is the evaluation plan, if you like, taking those outcomes and actually, if we want to know if the well-being is changing or et cetera, we need to collect this information and use it to kind of analyze the impact of that intervention. But we didn't end there. Obviously, really important, once you've done this evaluation, you've got all the data, you've done the reports and the charts, things like that, what do you do with it? Who do you want to speak to? How are you going to share the findings? And we talked about the various different audiences then there, you know, from the governors of the school, but importantly, something we talked about routinely is young people, the pupils themselves as a key audience for engaging them in the kind of the findings and helping determine next steps, which again, something I'll talk about in more detail in a moment. Next slide, please. Okay, so now to the bit that will be most interesting, I hope. Lots of learning came out of the project, as you can imagine, over the 6 years, and we kind of condensed this into kind of key outputs for the project over the 6 years. And I think they're all uploaded onto a website, which you can see the link here for you to have a look at, download, read at your own leisure. The first couple of is the final report, and also a executive summary of the final report, which obviously won't be an easy gateway into dissecting or understanding the information from the final report. And then there are a number of others, which I will kind of highlight 2 or 3 in a moment, I think are most interesting, but I think they won't be interesting, of course, but do check them out and at your own leisure, and hopefully they'll be useful. The first one I want to highlight is on the next slide, please. Okay, at the end of the 6 years, we wanted to report back to pupils on what have we learned, what have we discovered as all this work of 6 years, not just in this project, but kind of other projects as well. What's changed? What have we learned? What have we grasped of all this kind of work we're doing, all these surveys, all these evaluations, things like that. And we wanted to report this to pupils in a way that would be helpful to pupils. So this is designed to be a young person, pupil-friendly output. So it's not too long or too wordy or anything like that, too complex. It's nice and hopefully nice and easy to understand. We drafted it. We asked young people to look at it, and they told us, oh, you need to change this, that's not right, I don't like that, or things like that. So the result is a much better output. So we kind of we role played kind of how young people can make something better, if you like. So their kind of advice and kind of pointers really kind of made this, really honed it into speaking to young people. And it's, like I said, it's only short. There are 1 or 2 messages on each page that kind of the key things that came out of our learning journey over the 6 years there. So do check that out. And indeed, that can be shown to pupils, of course, or young people in any setting you work with. Next slide, please. Okay, so young people are completing surveys, the school gets a feedback report, lots of graphs, lots of information, really exciting then. But one of the key kind of values that we have is that young people should be involved in looking at the results and kind of having a say on what next. In essence, there's pupils completing the survey, it's their data. They've told you or told this survey how they're feeling about their mental health and well-being. So they almost have a right to kind of think about what's it saying, okay? And also, kind of the key thing as well we keep talking about is in terms of what do we do with the graphs. It's got difficult. What do we do with the findings? How do we dissect it? Talking to pupils is the best way because they are the experts by experience, if you like. It's very easy to make assumptions on some of the findings. Oh, that's because of this, or that might be because of that. But by talking to people about it, we can really just dissect it and kind of understand better what's going on. So we found that step of kind of taking reports and feedback and etc. to pupils new over the 6 years. It wasn't really happening early on, and we kind of did some work to kind of promote that over the 6 years, and it's kind of increased. But we wanted to kind of role model this and kind of do it ourselves. So we did, or colleagues did some work in schools where they took out the key bits in the survey, they shared it with pupils, they discussed it, found out what was interesting to them, found out what they thought about it, and also asked them for advice on what should be done as a result, the so what bit, if you like. So this report is about the process of doing that. But we can support schools and colleges to follow that same process. It's not about the findings of the schools, because that's kind of private to each individual school and kind of bespoke to them. It's about the process. So I definitely urge any school who are doing kind of any evaluation, any surveys, things like that, who are getting reports, getting findings, to read this and kind of hopefully replicate what we've done here and speak to pupils or all about it. Okay, next slide, please. Okay, I think kind of the last kind of output I want to talk about here is a kind of report kind of detailing kind of the key things coming out of our in-depth evaluations, if you like. So over the 6 years, I think there were sort of 10-ish in-depth evaluations, and we've kind of summarized them in 2 reports here, kind of the key what they were and what were the findings for each one. So you may find some useful things in there. Next slide, please. Okay, to summarize all of this then, there were 4 key things that we want to leave you with here then. What we found out, key learning recommendations, is there is a pragmatic approach to evaluation, which I've kind of shared with you a little bit. We kind of streamlined it into the idea approach, and it made it feasible for schools and colleges to follow. And we think it's feasible for all schools and colleges to follow to evaluate the impact of their interventions. I've mentioned the importance of context, and it indeed came up again. The importance of evaluating in situ is obviously massive. Every school is different, the population is different, settings different, etc. Really essential that we kind of put the voice of children and young people at the centre of what provision we're providing for young people and the evaluation of that, and helping to understand what next. And as we've heard today, and we'll hear more about today, is that programmes to support and promote mental health and wellbeing of pupils shouldn't be existing on their own, just kind of plonked in. They're best suited to be integrated into the wider culture, the whole school approach, if you like, that prioritises the wellbeing of staff and pupils. Okay, and I think that's my last slide. Is that right? Yeah, there it is. So thank you.
Brilliant. Thanks so much, Lee. Yeah, again, a lot to cover in a short period of time, but really nice to see some common themes coming out there. And I think some of the learning fed into some of the work that I think Roisin's going to talk about next, which was a bit of a collaboration. So yeah, nice way to move on. Over to you, Roisin.
Thanks, Jess, and thank you very much for welcoming me, and thank you to all who are listening today. So I'm Roisin McAvoy, and I work in the schools division at Anna Freud. And there I lead a team of expert former teachers and clinicians who provide training for schools. So our vision is really about all schools and colleges being mentally healthy, and to that end, we're providing training and resources to support them with that. Today, I just want to talk about one of our current projects. Next slide, please. So back in 2021, the school's training and national programs team, my team, and Cork were commissioned by the government of Jersey as part of their children and young people's emotional wellbeing and mental health strategy, so part of a wider strategy, to work with schools on the island of Jersey. And we did a number of different things, and I've listed them here on this slide. So there was a self-review framework for each school, and individual schools completed that to kind of explore their current provision and areas of strengths and opportunities to improve. There was the staff survey, looking at both knowledge and confidence in offering support, and also their own staff well-being and support that was available to staff. We conducted a review of existing policies that related to mental health and well-being in schools on the island. And then we offered a series of training workshops and reflective spaces. And then we developed a staff training and competency framework and reported to the commissioners. Now, as time is short, I'm not going to be able to talk through all of those. If you could just click on once, please. I'm going to focus in on just that 4th bullet point. Paula, if you click, so that's the training workshops and the reflection sessions, which were geared towards the development of a school action plan by each school. And the reason I've kind of chosen this bit of the work to focus in on was because we had incredibly positive feedback from our colleagues in Jersey schools to this piece of the work, this part of the work. 100% said that they thought it was useful. If you click on again, please, Paula. And in fact, 94% said that they thought this activity was extremely or very helpful. So I thought it might be helpful for you to hear about today. Next slide, please. So what were these school development sessions, these opportunities for reflection? Well, the purpose of these meetings was to discuss all of the reflections that we'd gathered about mental health and well-being at each school, and for each school to then create an action plan of next steps. We wanted to talk about what all that surveying and reviewing might be telling each school about their current practice, and then to really help them to think about what a whole school approach could mean for them. What would they want to prioritize? And it was really important to us that the process of goal setting for each school was, yes, informed by the work that we'd been commissioned to do on the island, but really vitally driven by the school staff themselves, who know and understand their own contexts best. So all of the Jersey schools were offered a 90-minute one-to-one school development session online with an expert trainer from the Anna Freud Centre. And all of the state schools and most of the independently funded schools on the island, in fact, so a total of 38 of the schools participated in this activity, involving a total of 76 staff, and they took place in April and May in 2022. The sessions lasted for 90 minutes. In some cases, it was just the head teacher or the senior leader with responsibility for mental health and well-being who joined the call. And in other cases, the meeting was attended by a small team from the school, including the SENCO in many cases. And the purpose of these meetings was to discuss the reflections that have been gathered and to then think about next steps. Next slide, please. So in advance of the session, schools were sent a copy of their completed self-review form and their staff survey reports that had been conducted by Cork. And they were also invited to bring their copy of the Jersey Children and Young People Survey. And discussion of these documents formed the main substance of the meetings that we had. And then school action plans were completed during the session, and then they were shared afterwards for revisions with the school staff. And then with school staff agreement, they were shared with the Government of Jersey. So what we were saying to colleagues was, thinking about everything that we've discussed in this meeting today, we invite you to propose 1 or 2 goals, things that you'd like to achieve regarding the mental health and well-being at your school over the next year. And they recorded these actions, they recorded the goals and the actions that would be needed to achieve those goals, and who was going to do those actions, and some time frames. So there was a kind of an accountability built into this process as well. So what goals did the schools set themselves? Next slide, please. What did the schools on Jersey decide to prioritize? Next slide, please. Well, quite a large number, about 60%, 22 of the schools were really clear that they wanted to use the next year to ensure that staff had good mental health awareness through providing training for everyone. So some of the goals were things like wanting all staff to feel confident to talk about mental health and well-being with each other, with the children, and with parents and carers. Or we had other goals that were things around staff feeling knowledgeable and confident to support families regarding mental health and well-being, including knowledgeable about signposting and referring to other services. And a similar number, or the same number in fact, also had goals regarding staff well-being. So there was a really strong sense coming from many of these schools that this work needed to involve staff, and I really like this first goal here, all staff feeling happy to come to school, confident that their mental health and their workload and their well-being is being supported. So that was really important to many schools. And some schools devised goals or worded their goals around really specific provision that they wanted to put in place to do that. So coaching and supervision embedded across the school's wider ethos and culture. Next slide, please. Again, quite a large number, 17 of the schools set themselves goals that were really around either policy development or policy deployment within their school. So things like developing a discrete mental health and wellbeing policy, one that reflected existing good practice and that allowed for future development was a typical kind of goal. But also there were schools who already had those policies in place and they liked the policy they had, but they wanted to use the following year they wanted to set themselves the goal of really operationalizing that policy. Fewer, but still a substantial number of schools asked to have goals or devise goals for themselves that were around student voice and community engagement. So we had goals around students being involved in the decision making across school life, or goals around involvement of family and parent and carers as well. And again, with maybe some specific thoughts about what might be most helpful for families. Next slide, please. And then we did have a substantial number of goals that were around implementing a whole school approach. So Hannah's talked about this and Lee has as well. But I suppose within this group, there was a real recognition that relationships, culture, ethos were areas that schools wanted to do more about. And so as well as staff feeling happy, this sense that pupils should feel happy to come to school and confident that their needs will be met. Or that this goal here, the ethos of the school continues to promote openness about mental well-being and encourages staff to feel comfortable sharing concerns. So I thought those goals also reflected another really important aspect of this work. And then ideas around curriculum resources for students were also mentioned, but less often. But there was some sense from some schools that an appropriate goal might be around reviewing and evaluating how mental health and wellbeing is represented in their curriculum, particularly the PSHE curriculum on the island of Jersey. Next slide, please. So those were some of the goals, or some of the themes of the goals that schools set themselves. So what happened next? Well, we were commissioned to work on Jersey for a second year. And so far, back in December, we've been back on the island providing face-to-face training this time. So we've provided senior mental health lead training specifically for Jersey schools. That's gone extremely well and it's being followed up just this week. My colleagues are over on the island again this week, and what they're providing now is really an answer to that goal from the 60% of schools wanting to be able to provide mental health awareness training to everyone in their school. So we're running a train the trainer set of sessions this week on Jersey. And next term, in the summer term, we'll run the development sessions again, like the ones that I've described to you, asking colleagues to reflect on the actions that they set last year and, you know, what challenges they faced, how they've overcome those, whether or not those were the right goals to set for themselves, and to really think about what next going into the next academic year. So I hope that was helpful and interesting to understand some of the work that we've been doing on Jersey. And handing back to you now, Jess.
Thanks so much, Rasheen. Really interesting stuff. Really interesting to see such a variety of goals there. And nice to see the staff wellbeing coming through as well. Great. I feel like we've got some really solid themes running across, and I might be preempting, but I think some of Anna's might chime as well. So yeah, so I'm moving on to a slightly different tack now, a bit further along the pipeline maybe, but yeah, really keen to hand over to Anna March, who's going to talk to us a bit about sustainability of interventions in schools. Thanks, Anna.
Thanks, Jess. Cheers. Okay. Oh, something's gone a bit funny with that slide. It's okay. This is just a quick cartoon talking about sort of after the novelty wears off. So yeah, I'm here to talk about sustainability. And this is, I got a cartoon drawn by a friend here, which just shows the cycle as it currently stands quite often in schools, where you've got teachers, researchers, governments, people pouring lots of money and time into an intervention. And it might work quite well. You might have some evidence of effectiveness from a trial, or people are saying it works and they're finding it very helpful. But quite quickly, within an academic year, sometimes it ends up on the shelf in the staff room or in the bin, and people's mental health is still a big problem. And then someone spots over there a shiny new intervention, and we sort of go again. And that seems to be something that's happening quite a lot at the moment in schools. If you go to the next slide. Thank you. Yeah, so just to clarify what I mean when I'm talking about sustainability, I guess I was really focused in my PhD on what happens after something like a research trial. So once the initial funding and that excitement and all those resources have sort of been withdrawn from the school. And you can look at it at different levels. So on the left here, you've got sort of the pupil level, so the desired outcomes being maintained over time. Then the organisational or school level, you've got maintaining the programme in some identifiable form. So it might have had a few tweaks and adaptations, but it still looks like the programme. And then at the wider community level, it's about maintaining capacity. So those are different ways of thinking about sustainability. And there's also been a shift recently to understanding sustainability not just as this outcome, so I designed a great programme, therefore it has been sustained, but also thinking about it as a process, so this dynamic process where staff are involved and activities will be sort of modified over time. So that's just what I mean when I'm talking about sustainability. If we go to the next slide, there's some key sort of barriers and facilitators. So I won't spend too much time on this, but in my PhD, I spent quite a lot of time at the start thinking, what are these key problems then, and what are the challenges, what helps when it comes to sustaining these types of interventions in schools. There's been a fair amount of research on this in healthcare and in public health, but when it comes to schools, there's very limited research out there. And so some of these are probably quite obvious, but you've got school leadership, staff engagement, turnover is a key barrier, of course, whereas commitment from individuals, so having sort of a programme champion was a real big facilitator in some cases, and also perceived benefit. So yeah, staff thinking that it helped their pupils and made a big difference. The characteristics of interventions in box 3, quality of materials, whether or not it fits with the school, and it could be whether or not it fits with values and sort of ethos like people have been talking about before, but also like in box 4, you've got logistics and really practical things. So are you trying to bring in a programme that needs an hour every week, but there's not an hour every week in the timetable, for example? So there are lots of school level barriers and facilitators. And then at the wider system level, they also talked about sort of external support. So quite a few of the articles in the literature from the US, they talked about district-wide initiatives and how things were much more likely to be sustained if there was a sort of district-wide focus on something. And across both levels, you had things like shifting priorities and needing to sort of be consistently focused on the same thing. So we go to the next slide. I'll just focus in on one bit of my PhD. If you just click again or get the text up. So this was based on a project called Education for Wellbeing, which is an ongoing research trial run by EDPU. And this is looking at 5 different mental health interventions in schools. And I was able to follow schools from the first wave of that. So they started delivering these interventions in 2019, and they did it for about 3 months, so school term. And we went and spoke to them at the end of 2019. And then I was able to speak to them across nearly 3 years. So unfortunately, things got a bit interrupted by COVID, but I managed to stay in touch with some schools. And I sort of followed 8 schools after this programme and after this research trial to see if there were any patterns of intervention delivery and like what happens once the research trial's over. If you go to the next slide, there are 4 different types of school journey. So if you click for the next one, we've got type 1 and click again, we've got spreading and embedding. So these schools, when I went back nearly 3 years later, had managed to embed and spread the interventions across lots of different year groups. And they had a really strong sort of wellbeing team. It was being prioritised by senior leaders. These people who were in charge, the sort of champions, had specific roles around mental health. And although there were challenges to delivery, so things like timetabling, this team had managed to overcome them, and they'd used sort of creative methods to make sure that the interventions were still being delivered nearly 3 years down the line. And then type 2 was called built into the curriculum for now. And if you click again, there's a few key points here. So type 2, they were only delivering sort of 1 year group, and it was often just 1 member of staff. So it was still there, it had been adapted a bit, but you just had this one individual delivering again and again to the pupils. And even though senior leaders had said that it fitted and that it worked well, there wasn't that sort of prioritisation and cascading across the school. So there was a real sense of precarity here that, if that individual were to leave, then the intervention would probably leave with them. And then if you go to type 3, these people were no longer delivering it by the third follow-up point. And again, it had gone quite well in this initial phase, but they've had more challenges perhaps around things like staff buy-in and timetabling issues. And so even though they were quite positive about the intervention, senior leaders seem to have prioritised other things like, I don't know, some schools had brought in school counsellors for sort of specific targeted support. Other schools had decided to use a different PSHE curriculum. So they're still doing things for mental health, but not the intervention that they'd been given as part of the trial. And then finally, type 4, this school, everything had changed. So by the final time point, nothing was being delivered. And this had been as a result of a change in leadership. There'd been big turnover of staff, and there'd been criticism as well of like the previous leadership and the way things were working. So it's sort of swing to prioritising attainment and academic outcomes, and anything to do with mental health and wellbeing is a little bit out of the window. So if you go to the next slide, I think this has already been touched on by other people, but we really need to talk about context. So if we just get the next slide up, if you bear with me here, we've got a river, and if we just click again, there's the schools are a boat, and so this is my way of trying to explain it. But if you think about schools sort of traversing this river and thinking about their supporting their pupils with their mental health and wellbeing, there's lots of similar challenges. So I've tried to represent staff turnover here with a bit of white water. COVID-19 is this fallen tree that came crashing down and changed everything for people. And I guess, yeah, this is the context that schools are working in. Then if you click again, the intervention is, in some ways, it's often this sort of like shiny golden paddle that people are trying to design. It's like, if we can design this intervention, we can put it into schools and it will work really well across the board. But if we go to the next slide, this was really different. And I think, yeah, my patterns there across these different schools shows quite how different they are. So with type 1, if you just click again, you've got type 1, they're spreading and embedding. So they're all sort of managed to replicate this intervention, and everyone's pulling in the same direction. It's going really well. Type 2, however, you've just got that one person in the boat keeping going, but if they leave the school, then the intervention is going to go with them. Type 3, they tried it and then they just moved on to other things. So they're using different paddles, not focusing on the one that we gave them. And in type 4, I think they're basically the sort of pulled up on the bank, dealing with major structural issues, and they don't really have time for something like this. So I guess this just shows the diversity in schools' experiences. They all were given the same training, they had the same sort of start with this trial, with this project, but they went on such different journeys. And I guess it's just made me think that we might need to shift the focus awareness a bit from designing that perfect one intervention that could be rolled out everywhere, and thinking a little bit more about interventions in different contexts, like the leading option you mentioned, and yeah, thinking a bit more about the boat and the river. If you just go to the final slide, please, thank you. So just to sum up, from everything I've been doing over the past few years, there's a few key recommendations. And they're for different people because lots of us are involved in sustaining these interventions. So if you just click for the first one, we've got school leaders. So key thing here is planning for sustainability, and not leaving it to the end once you've been doing something for a few months, but thinking about it at the very beginning, investing time, getting your staff members on board and so they understand why they're doing something new. And being realistic as well about timeframes. So lots of people were saying in interviews with me that you can't embed something like this in a few months or an academic year, and you need to think a bit longer term sometimes to get things like this off the ground. And then if you click again, we've got intervention developers. So this has already been talked about quite a lot, but having flexibility and adaptation in there, allowing schools to tweak and change things, and thinking more about the specific sort of capacity and priorities of each school. And like Roisin was saying, they're co-designing with school stakeholders, so getting them really involved from the start, not sort of designing an intervention over here and then trying it out in schools. And then next, we've got researchers, so me, using sort of approaches that think about complexity and think about all those different interconnected parts when we're looking at schools. and trying to identify sort of best practice and think about how we can expand that and scale that up. And then finally, we've got policymakers and funders. It obviously can play a massive role here with prioritising mental health and wellbeing consistently and investing in these types of initiatives over a longer period of time and allowing more time for research as well, so we can actually see what happens further down the line. And that is where I'll finish so that people can have a quick break, hopefully. Thank you.
Brilliant. Thanks so much, Anna. Still very taken with your river and paddle analogy. I'm going to ask if our panelists can maybe turn their cameras on. So that's our speakers and our champions as well. That would be great. And I can see we've got some questions already coming in the Q&A and a couple that have been answered as we've gone along. So that's great. So I'm going to hand over to you, Martha, for chairing this part of the session.
Yeah, firstly, I just want to say thank you so much to everyone. That was an incredible breakneck speed through loads of really interesting information. So I'm going to give you a break from speaking for a few minutes. I kind of want to put a question to our champions because they obviously bring really important voice and experience. And also they, like you, have sort of sat through the content and heard what we've got to say. So I'd really love to know from your perspectives what effective support for children and young people's mental health in schools looks like for you, and also thinking about some of the things that we've shared today and how they may fit into that. So give you a minute to ruminate on that, and then I will just encourage everybody else to keep popping things into the Q&A. And also, if you see anything in there that you particularly would like answered, you can click on it to upvote it, so we know that that's something you're more interested in hearing about. And I'm not going to pick on any of you, so whichever of the champions is ready, raring to go first, you unmute yourselves and answer my question.
I do want to go.
Yay!
Yeah. Okay. Well, like, to preface this, I'm 17, so I'm in year 13. I'm in college. But effective mental health support, something I've been thinking about since secondary school. Right, my secondary school had a very bad support network in terms of who you could speak to. Honestly, didn't feel that great with them. I ended up speaking to people I wasn't even supposed to be speaking to. I just got sent there and ended up worse than I went in. For me, I personally just think it should always be external help. I've never found it comfortable talking to people that work with my teachers or work with people that, you know, have my parents' details and would definitely speak to them. They don't have the same confidentiality that therapists do, in my opinion. And I've had both. You know, I've spoken to schools, not extensively. Like, I've had like one moment where I had to go to them, and even that put me off completely. And I've been to therapy. I've done both, and I've never had someone really have a good experience with school. It's always been people that are like safekeeping people, you know, not really like counselors or therapists. It's been safekeeping guardians and stuff, and they're just kind of there on, like, it feels kind of like on a whim, like we have to have them, so we have them, and they say things and they don't actually know what they're doing, and they're biased because they're parents or they were teachers, and they have all these biases and they don't actually want to help you. They want to tell you what they think. Like, if I go in with a problem, then it's like, oh no, your parents aren't immature, they'll speak to you eventually. And like, well, you don't know that. You don't know my parents. You're a parent and you think that's what's true, and it's not. And I always think it should be external help, professionals who have been trained for it.
I think that's a really good point and really interesting to hear from your experience there. I suppose I just would like to follow up and wonder if anything you've seen and heard about today, do you think that would have impacted your experience, or what positives did you see potential in anything that we were talking about?
I think it's interesting to see things like this, where you're talking about schools that wanted to participate in these things and had all these trials and kept them on board or didn't keep them on board, because I've never heard of someone who's gone to a school who has even tried any of this. I mean, even if it doesn't work, I think it's insanely great for a school to even want to try it, because leadership in schools doesn't really tend to care about mental health, in my opinion. Maybe I'm wrong, this is my experience, but they do care more about grades, and it always is like that. And just trying it, I think, is great. But I do like, I don't know, it wasn't like very in detail, but yeah, I think it's great.
Thank you, Ash. I think Jess wanted to respond quickly, and then we'll move over to Dina.
It's not my spot, so I'm just going to chip in really quickly. I think it's a really helpful reminder, Ash, that I think there's a real focus on schools as a real opportunity, and I do still think that's right to a degree. I mean, to a greater degree, when we look at lots of young people say they would want to talk to people in school, but we have to remember there's actually lots of young people who their experience of school wasn't great, or it's not the place they would go to for help. And I think some parents and carers feel that way too. So it's really important to remember that there's lots we can do, and there's lots of scope in schools, and there's definitely scope, like you say, to show more kind of investment across the board in saying this is what we're all about. But also it's important to remember there's a bigger ecosystem, and some people will just choose to access help elsewhere, and I think that it's really important we don't lose sight of that. Thank you.
And then I think Dina wanted to go.
Yeah, thank you. Yeah, I just wondered how reputational damage featured in all of this, because my children went to a school where there was really an epidemic of self-harm, and the school didn't engage at all with parents. There was no communication. They basically pretended it wasn't there. And it was a high-achieving, Ofsted outstanding school, and I got the impression that they were concerned about reputational damage. And I just wondered how, if that featured anywhere.
I think that's an interesting point. I think we'll ruminate on that for a second, and just pop over to Nicola.
Thanks, Martha. I think my experience is slightly different. I appreciate that obviously lots of people seek professional help, etc., and the schools have very different agendas in terms of what they want to get out, at the end of the day, grades, for example, attracting more pupils. But I do think it's really is amazing the kind of lengths that the schools are going to make mental health really at the heart of the school. And from what I've seen today, there are so many things that that schools can take on board to improve the mental health in children. And a couple of things I thought of that have kind of been touched upon, but maybe not in depth, is teacher availability, for example. I know teachers are very busy, but just making sure there's that kind of open communication channel for parents to come in and see the teacher and talk to them, and the same with the students as well. And again, we touched on it earlier about the teacher's understanding of mental health conditions, and not to be dismissive of things. And this applies not just for the specific member of staff dealing with a child's classroom, but for all staff. For example, my son had anxiety, and one of the teachers kind of managed it, but the other teachers weren't really advised. So if he was late due to a violin class, he would get told off, and that would kind of inflame his anxiety. So it's kind of spreading the word around that. Again, as we said about education of classmates, teaching them about the conditions, having neurodiversity week, for example, helping them to look out for, if someone suffers panic attacks, helping them look out for, what might be the kind of symptoms of a child coming up with a panic attack. So it's a collaboration. It's not just kind of the teacher and the child with a mental health condition. It's about, as everybody said earlier, the whole school approach. And something that really touched me earlier, actually, I was working on another project. It's from our very own Professor Peter Fonagy. And this is about learning, but I really think this applies to supporting and forming trust with pupils with mental health issues. And he said, the ability of a child to learn from a teacher depends on that child trusting the teacher, just the same way that a child trusts their parents or other adults. When we trust someone, we open our minds to them, open our ability to learn. So when I think about teachers who have influenced me, they were teachers who actually took an interest in me as a person. And I think that's the core of it, really, kind of the teachers having this very good relationship with the pupil and just showing an interest in them and believing in them, I guess. So that's what I've got to say on that.
Thank you, all of our champions. That was a really interesting array of different thoughts and challenging ideas as well. I'm going to open it up to some of the things that are coming through in the Q&A, but one thing I really wanted to share that I've just read in there, which says mental health and well-being should not be a tick box exercise. It must be reinforced regularly. And I think that's come through in all of the presentations, and everything we're saying here today is that if we're going to do this, you need to do it well, and it's not just a tick box exercise. So I just wanted to read that from there. So yeah, there's a lot of different things coming through in the chat. A couple of them are quite direct questions about resources, which we're trying to answer in the Q&A there. And I'm just going to find one that I wanted to go to. But if anyone on the panel has any reaction, thoughts, or anything right now while I'm just scrolling through, do let me know. One really good question, I think that kind of goes towards more Lee and Roisin, was were there any sort of very tangible kind of causal links that were found between teacher mental health and pupil mental health that you may have seen in these projects or anywhere else? And Roisin's got a hand up.
Thanks, Martha. Well, I had my hand up initially just to kind of really support what Nicola was saying, and to kind of just to think about how relevant and important Nicola's contribution there was. Because I guess for us in the work in Jersey that I talked about today, but just working with schools generally, we're always really we're really determined to promote the message that the work we're doing in schools is not about turning school staff into clinicians. And I think, as other contributors said, they're not necessarily the best people to try to take on that role of clinicians. Teachers are not clinicians, and they're that's not their mission, if you like. But it's very much about what are you doing around. So a child may need clinical support, but they also need a school where they feel connected, where they feel that they belong, where they have good relationships with the adults there. So it's, I guess, when we talk about that whole school approach to mental health and well-being, it's that thing Nicola says about school staff knowing the child and having that relationship, and the piece that Nicola brought from Peter Fonagy about trust and all of that stuff around relationships, I guess, is for me really central to this. And there's only so much that school staff can do. That they're under enormous demands now more than ever. But I suppose that bit, trying to get better at that bit around relationships, seemed to come through a lot in the work that we did with school staff in Jersey when they were setting themselves goals. We didn't really look at the issue of the in any real detail of the connection between staff wellbeing and student wellbeing. We didn't really set out to do that, but what I would say, Martha, in answer to that question, is it does seem to come through strongly all the time in the things that school staff talk about, how their own mental health and wellbeing was under considerable pressure because of the work that they were doing. But that might be one that others, I know there is some interesting evidence around this, so I'll let others join in.
Lee, I wonder if you've got anything to add on that point.
Not especially in terms of hard evidence. I think it's intuitive, isn't it, that you can't provide support if you're struggling yourself. We hear this from teachers all the time. How can I support when people are struggling if I'm struggling, and things like that? So I know this, and many of us feel this as well. And well, as Roisin said, the teachers are telling us this. In terms of hard research, hard evidence, I have to pass it up to Jess. I don't know if you know anything about this topic, Jess.
I was just racking my brains on that. It could be that I'm missing it. So it's always hard to prove something doesn't exist. But I don't think there's any compelling evidence. I think that analogy of putting on your breathing apparatus on a plane before you can help somebody else kind of makes sense. But I was just thinking, Lee, this is something we could actually explore with the Cork data. So if there isn't evidence, we would be the people to look at it. My guess would be the relationship won't be huge, but I think it's just the bandwidth of teachers, I think, is really eroded by challenges to their own well-being. And I think it's important in its own right, isn't it, to prioritize.
Yeah, I think it's worth acknowledging we're aware of the situation in the broader world and society right now, and we don't have a silver bullet answer to all of these wonderful and interesting questions. This is just the dialogue that goes along with everything. So I'm going to swing us back to what's coming through in the Q&A. So there was a question around whether we found sort of a correlation between successive schools implementing whole school approaches and having senior mental health leads being part of their leadership model within the school. And that's quite specific. So I wonder if maybe we speak a bit more about success in whole school approaches and what that has looked like outside of some of the examples we've given, maybe, and maybe, I don't know, Hannah or Roisin or Lee or anyone has anything to say on that.
I'll let Hannah go first, but I've got.
I think there is some evidence to suggest that having a lead in school to coordinate a whole school approach is optimal, but specifically to the senior mental health lead kind of initiative that's, I know, rolling across England at the moment that goes alongside the training. I'm not sure there is some robust data on that at the moment. I can stand corrected if there is, but I'm not aware of that. But I ultimately see a whole school approach as a whole community, a whole school approach, but with a senior lead coordinating that, very much being a coordinator of provision, if that makes sense. It should be everybody's role within the school to feed into that. Hope that was helpful.
It was, thank you.
Just to echo that a bit, yeah. Yes, again, like talking about complexity and all those different people in the school needing to sort of be putting in the same direction and working together. But just to say that from those spreading and embedding schools that I had, they were schools where a senior leader was on the project and was driving the project forward. And I think that probably does say something about the importance of senior leadership involvement. Another recommendation as well, when I was asking people what to do about sustainability, was to have senior leaders go on the training. So that was a key thing that came through as well.
I think with, you know, the senior lead being able to be in a position to affect whole school change and be able to feed into those policies which are connected is really key. So yes, having somebody on that senior leadership team is paramount to affect that whole school community change. I agree.
So just having a quick look at the Q&A, we've had quite a few sort of comments and queries around does a lot of the things we've talked about apply to primary, and what do we think about sort of getting in there at an earlier stage and well-being being taught at a much earlier stage as a sort of skill within schools, and sort of I'm opening that up to everyone more broadly and how people feel about that. I know that well-being is quite a broad term, but I want to see sort of what the feel is around getting this into schools earlier and how we feel that plays a role or doesn't, or
yeah, I mean, in terms of personal opinion, I think it's getting it into teacher training early. And I just think so many teachers talk to us about how this is an aspect of the work that they don't feel that they were well prepared for, by the initial teacher training that they had. So I think there's definitely something there about how understanding of what the teacher's role is with regard to mental health and well-being, whereas it's not the role of a clinician, but what that role is, I think is really important. I wanted to also say, just in terms of that piece around the impact on teachers' mental health and well-being, I've put it into the webinar chat, but I think it's only going to the panelists. The OECD have got some quite interesting information on this and evidence around it, and certainly things like what they call disciplinary climate. So I guess that would be some of the challenges which colleagues are putting into the Q&A now around having to try and support young people who are very, very distressed, who are not accessing the support they need from outside of school, does have an impact on teaching staff's well-being. So I do think there is some evidence around that too.
Thanks, Roisin. Does anyone else have any thoughts on that point? Go for it, Ash.
I think, sorry.
Is it okay if I go, or do you want to go?
Yeah, absolutely. You go, Ash.
It was just, I saw someone put in the Q&A something about like, if like, to the young people, I guess it was like, if I had gotten, for example, in primary school, had been taught to talk about my feelings more, would it have helped? And I think that's such a mixed bag. I think anything to do with kids is such a mixed bag, because you don't know the family dynamic that goes on at home. Like, I'm an immigrant and my parents have a very different view on mental health than other parents would have. And I know plenty of people who have parents that you just wouldn't want to talk about your mental health with, or even if you do, they won't believe you. They don't think it's real, and it's very demonized in other countries. So I think it could be just as detrimental as it could be helpful, because if as a kid I was taught, I can talk about my feelings, I can talk about my mental health issues and my experiences, and then I begin to talk to my parents, but my parents don't see it like that and diminish it, then it would make me feel worse than if I had never really opened up, in my opinion. But that's what I think.
Thanks, Ash. That's a really good point. Hannah?
Yeah, I was just going to say, I actually started out working in primary schools, and I think it's really key to kind of start early on to build emotional literacy as early as possible, really, to promote, understanding of oneself and how we relate to others and expressing emotions. I mean, that's my take on it, but with the whole school approach, it can absolutely be embedded across the age ranges. So the Public Health England model that I shared, which has informed our Anna Freud 5 Steps to Wellbeing model, is absolutely something that can be implemented across the age ranges within a primary school, a secondary school and FE colleges. And it's been done very well as well across the age ranges. So yeah, would recommend a whole school approach in primary schools.
Thanks, Hannah. Okay, we're coming up towards the end, and I'm always very keen for us to finish on time, otherwise I get locked in the office. So I just wanted to open it up to anyone else who had anything they wanted to reflect on or share before we close out this session. Anything you've been burning to say, or a response to anything you're seeing coming through in the Q&A?
I'd just quickly like to support what Hannah said actually about mental health in the early years. Obviously, there is a massive issue around kind of culture, etc., as Ash pointed out, which I think is a massive issue. But I mean, I was speaking to my niece yesterday who has autism, and I said to her about, let's help you with your mental health. And she actually said, mental health? I'm not mental. And it was just so surprising that a young child wasn't aware of the word mental health, when of course we should all be talking about it from a very early age, because if we're not talking about it, then we can't discuss it and we're not doing anything about it. So the earlier we do something about that, the better.
Thanks, Nicola. Okay, I'm going to hand back over to Jess to close us off. But once again, thank you to everybody and everything you've popped in the Q&A. And if there weren't any specific questions around resource or anything that we got to in the chat there, please do drop us an email and we'll try and respond to links to any of the resources you don't think you've got yet.
Brilliant. Thanks so much, Martha. We're nearly at time. I definitely don't want you to get locked in the office. So just a couple of reflections from me. I think all of the talks were really rich, and thanks so much for being up for giving us such a deep dive in such a short period. But some common themes for me were just, this cookie cutter approach that we sometimes take. We just think about isolated interventions, really. Isn't the way to come at this from, and the importance of context to the work we do, and how much all of the schools and colleges that you've each talked about have really thought about how they tailor this to their students, their context, hopefully their parents and carers as well, their students, parents and carers anyway, is something that's really important. And how implementation matters as well. I think there's been a real theme around building capacity across the school, not just within isolated individuals, for a whole school ethos. We're all invested in wellbeing, collecting practice-based evidence based on the fact that context is so important. So what's learned elsewhere, it doesn't always translate perfectly into a different setting, and just general awareness and being kind of comfortable with talking about mental health. And I think that's those things all feel really coherent and really important. But also I saw some of the comments in the chat about not edging school-based staff into a position where they feel like they've got to be the clinician because there's a gap in specialist provision, or they've got to be the therapist. So I think we need to be really clear that there's definitely a role for schools to play, but they can't step into that specialist space, but there's plenty that they can do. And also remembering, like we were just saying, that school isn't the only setting, and that we need to think about how this fits into the wider ecosystem and the other settings that young people find themselves in the community, in the home, and so on. So I think those all feel really important. And, you know, the active engagement and involvement of young people in this agenda, and understanding what it's about, and thinking how it can land in a way that feels sympathetic and thoughtful. And I think some of the points that Ash made there about where the unintended consequences can come through, you know, that involvement of young people is really important to unearth some of those things that are really crucial. So that feels really important as well. And again, the sort of buy-in from leadership as well. So yeah, those are things that really seemed crucial to me. I will be lynched if I don't tell you that when you finish, please do, you'll be directed, I think, to a feedback page. If you could give us feedback, we always try and improve as we go. So any sort of comments about how we can make this better, that would be great. It just leaves me to say thanks so much to everybody who's spoken, to our panelists, and to our support team who've been helping behind the scenes with all of the smooth running of the session. Thanks to everybody, and yeah, thanks to you all for joining us as well and joining in the conversation. Thank you. Bye-bye.